Every patient encounter, insurance interaction, and scheduling call now carries an administrative weight that has become a constant presence in the modern clinic. For many practice owners, the difficulty of running a practice today stems less from clinical care and more from the sheer volume of these non-clinical tasks. AMA data reveals this time drain. Out of a 57.8-hour workweek, physicians spend 13 hours on indirect admin tasks. Losing 1 in 4 hours to paperwork impacts the team. In 2024, 43.2% of physicians reported burnout. This pressure is mounting. The Medical Group Management Association's 2026 report highlights escalating federal and regulatory requirements, specifically prior authorizations, as one of the most disruptive challenges medical practices face today. When the burden becomes too high, the practice itself is at risk. In 2024, 27% of medical groups reported a physician leaving the practice entirely due to burnout, leading to high recruiting costs and productivity gaps that force consolidation. The scale of this inefficiency is measurable. According to the CAQH 2025 Index report, while automation saved billions, there is still a $21 billion savings opportunity by fully automating manual administrative transactions. Practice leaders are already responding to these figures. Research shows that 90% of health executives are currently exploring cost savings through third-party vendor partnerships. This shift suggests that administrative volume has outpaced the capacity of traditional in-house hiring. Solving it requires a structural change in how back-office tasks are handled, bypassing the limits of traditional operations. When independent practices reach this operational breaking point, they often look for specialized external support. Staffingly provides these remote teams. Their impact is documented not through a corporate pitch, but through the verified reviews of practices across 9 different medical specialties. Dr. a psychiatrist, posted a 5-star review after hiring a virtual medical assistant to manage his administrative workload and reclaim his time. At a surgical practice, Administrator integrated a virtual medical assistant as a wonderful remote team member, treating the external support as a core part of their daily operations. An office manager at an endocrinology practice recommended the service after a remote team brought their chaotic prior authorizations under control. The model also addresses large backlogs. One pediatric autism network used a remote team to successfully clear a queue of 140 pending ABA assessments. While these practices differ in specialty, they followed the same logic. They identified their highest friction administrative task and moved it outside the internal clinical team. Most practice owners are naturally cautious when considering this change, especially if they have dealt with unreliable in-house hires or previous outsourcing attempts that failed to meet their standards. To address that risk, any external partner must meet a non-negotiable baseline of security. This includes strict adherence to HIPAA, SOC 2 Type 2, ISO 27001, and HITRUST frameworks. These certified teams are designed for rapid deployment, typically going live and integrating into existing workflows within 48 to 72 hours. The transition also changes the cost structure of the office. When you account for the loaded cost of an in-house employee, including benefits, payroll taxes, and training, an outsourced team typically costs $60 to $70. Moving these tasks to a specialized partner is a high-security operational upgrade that bypasses the friction and overhead associated with traditional staffing. The footprint for this approach is significant. Staffingly has supported over 800 medical practices across the U.S. for more than 8 years. This operational shift has led to a major financial impact for those clients, who have collectively saved more than $14 million. The long-term reliability is also documented. One pharmacy chain grew its relationship from a single location to over 150 staff members, supporting 14 locations across 13 states over a 7-year period. With the administrative burden continuing to grow across the industry, every practice owner has to decide how much of that weight they are willing to continue absorbing themselves. You can see the impact on your own operations by visiting staffingly.com/demo or calling the number on your screen to start a 30-day free trial. By moving the administrative burden to a verified partner, practices can stabilize their overhead and return their primary focus to patient care.